My name is Jeanette Bell. I am a graduate student at Jacksonville State University. I obtained my master's degree in population health with a concentration in nursing education. And I'm doing my preceptorship here with Dr. Hendricks. So I just want to thank her and Dr. Hankins for this opportunity. Objectives. At the completion of the learning experience, the student will be able to define epidemiology, understand concepts in epidemiology, define morbidity and mortality, and understand the relationship to community health, identify the three components of the epidemiologic triangle, identify the levels of preventive interventions as it applies to community health, understand the difference between reliability and validity, and demonstrate how to collect data within the community. And you all are doing that with your windshield survey. So that is collecting data from the community. I thought this little meme was funny, with it being the flu season. In this particular episode of Oprah, she was giving away cars. But here, we're giving out flu. So, always washing your hands, covering your coughs, throwing away tissues that you blow in your nose and all that good old stuff in. So you won't get the flu. She said, you gonna get the flu, you gonna get the flu. Everybody gets the flu. Nobody wants the flu. Epidemiology definition. The study of the occurrence and distribution of health-related states of events in specific populations, including the study of the determinant influencing such state and the application of this knowledge to control health problems. So basically, it's just collecting data to find out about a disease process. You will get all of these PowerPoints at the end of the presentation. Dr. Hendricks will send these to you. EPI attempts to answer the who, what, when, and why. Who has the disease? Is it the old? Is it the young? Is it the immunocompromised or the healthy people? Why is it causing people disease? Like I said, is it because they're sick already? They're getting more prone, they're not washing their hands? Why do some people get it and some don't? If I'm sitting here with Miss Morgan and she coughs, I get sick, but Miss Kazaria doesn't get sick. Why? What should we do to prevent it? Multiple things can be done to prevent certain things. Background. William Farr. He was a forerunner for epidemiology. He created the vital record data. John Snow, he's known for being the father of epidemiology. He correlated the relationship of the water supply to a cholera outbreak in London. Florence Nightingale, you all should know her. Who is she?
Mother of Nurse. Lady of the Land.
And she was the first Edward Jenner, observation on smallpox to the vaccination. William Farr, like I said, he was a physician, and he believed in the Mosomia theory, which means he thought that all diseases came from being bad air. You breathing in bad air, so you get sick. Well, John Snow came behind him and said, well, no, hey, there's something else going on here in London. They're not just getting sick because it's bad air. So he traced it back to a water pump that was giving off the main water supply to the people in London. So they were getting sick because of the water supply in London. And he used Williams Farr theory to collect the data, to put it together to say, okay, this is why everyone is getting sick. Historical beginnings. These two websites, one is about John Snow, and it gives you all of the information on the cholera outbreak and the things that were done to find out about the outbreak. And then this other link about Florence Nightingale, it's basically based out of London. So it has like all of her books, and it gives you like a whole rundown on Florence Nightingale. So when you get a chance, if she sends these PowerPoints to you all, click on it and view what is there. Essential concepts. Populations at risk. Who is the disease going to affect? Agent, host, environment, triad. Multiple causation. Person, place, time. Natural history. Measures of morbidity and mortality, and levels of preventive interventions. The nurse's role in epidemiology. Everyone has a role to try to prevent a certain disease, any disease process, whether it being the flu, or and telling them to wash their hands, or whether it being heart disease, telling them, hey, you need to try to eat right or exercise more. It's similar to the nursing process. First, you're going to assess the situation. Defining the condition, determining the natural history of the condition. So you want to know the background on where it came from, who founded it. Determining the influence in the condition, what brings it on. Is it caused by, like I said, people not washing their hands from the flu? I like flu season, because it's flu season. Distribution patterns, condition frequencies. Then you're going to analyze. Identify strategic points of control, designing control strategies, implementing control strategies. What are you going to do? How are you going to stop it? Evaluating. Why you doing all of this? You want to be writing down your numbers. Okay, well, this seems to be working, but this not working. This is working, but that's not working. So that's your evaluation when you can look at the end and see if what you were telling people to do, is it working? General concepts. Risk. Who is at risk? Risk, the probability that an event will occur. The probability that a given individual will develop a specific condition. Excuse me. Y'all, this sinus stuff is killing me. Populations at risk. Group of people who have the greatest potential to develop a particular health problem because of the presence or absence of a certain contributing factors. Is it because they're African American? Is it because they're Latino? Is it because they're in their 65 plus years? Is it because where they live? They're not high class in the high class dimension, and they can't get everything that everybody in the high class dimension can get. Populations at risk. Persons with characteristics that increase their potential for an illness, injury, or health problem. I think it was Jalen that talked about, was that you? That talked about no, that wasn't you.
Probably was.
No, that talked about the measles outbreak. Kayla. Because the children are being immunized, is causing more cases of measles in little children. Non-active persons, what you get? Heart disease, diabetes. Smokers, put you at risk for lung cancer. Child abusers, and economically deprived. And like I said, heart disease, smoking, hypertension, elevated cholesterol, lack of exercise, stress, even a family history can put you at risk for heart disease. Motor vehicle accident, if you choose to drink and drive, the outcome could be anything. You may make it there safely. You may not. Wearing a seatbelt. Oh, I'm just going to run down here to the store, get me a drink from the store. Don't wear a seatbelt. Bam, you're in a car accident. High speed. I took a training from a state trooper a couple of years back, and he said, do you know why the highways have set speeds? Me, I'm just like, I don't know. He asked me, do you drive over the speed limit? I said, hey, plenty of time. Got plenty of speed to teach. He said, well, roads are built specifically for that speed limit. So if the interstate say 70, 70 it is. I know it. None of us abide by it, but that's what it says. He said they are built for that specific speed limit. Nutritional deficits, dental caries, and lead poisoning. You really don't hear about a lot of lead poisoning now because people that build houses and paint, they're not using as many lead-based paints now. So you really don't hear about a lot of lead, but I did hear on the news early this week that they were concerned about juices for kids. Juicy juice, apple juice, it had some particles of lead, but they, the Food Drug Administration, FDA, said that it was not enough to do any harm. So, yeah. So they still juicy juice.
Just one thing thrown here, public health did a super job, one of the best in the nation, at controlling lead, and guess what happened? I mean, we have one of the best lead rates in the nation. The feds cut our funding by 3/4.
Wow.
Well, we didn't have the lead problem because we take care of it, and then the government cuts it. So sometimes the bureaucracy can really hurt our patients, and we can't do anything about it.
Thank you, Dr. Payne. Poor dietary intake and planning. Rate of occurrence. Statistical measures that indicate the extent of health problems in a group. So your rate of occurrence. How many people is it affecting at that point in time? Allow comparison between groups of different sizes with respect to the extent of a particular condition. So if you want to say, okay, I want to take lung cancer, I'm going to put 25 mixed black and white here, 25 mixed black and white here. We're going to do one thing here and do one thing here. And at the end of the study, you put it all together and you compare your data to see, okay, who came out healthier from this intervention. Calculated by the divided number of instances of an event during a specific period by the population at risk for that event, and multiplying by a predetermined number, usually 1,000. That's just basically saying you taking your, I think it's the affected group on the top. Correct me if I'm wrong, Dr. Hankins. Your group that is affected on the top, correct? And then on the bottom, your population. And you're going to multiply it by 1,000. And that's how you get your rate of occurrence. Things to remember. If population varies over time, use the number at the midpoint in time. So just say, for instance, you know, in 2019, by January, by June, you had only 400,000 population. And then at the end, in December, you only had at least 300,000. So you would take your midpoint of the 400,000 and use that as the common denominator. Use common sense when looking at rates. If it looks impossible, it's probably impossible. Identify co-modalities and differences among the groups. So co-modalities, do they have diabetes and hypertension? And what is the difference of the group? Is it these over here are 200 pound plus, bless you, and these over here are 250 plus? Major rates of occurrence. Mortality rates, the ratio of the number of deaths in various categories to the size of a given population. So this is your death. Mortality is death. I used to get those words confused. Morbidity is the ratio of the number of conditions at a given time. So morbidity is how many people does it affect. Mortality means how many people died from it. The incident, the rate of new cases in a given time. So incidence is the new cases. So if you were diagnosed yesterday, you're part of the incidence. Prevalence is the total number of everyone together in one group. Approaches to the epidemiologic investigation. So these are your different kinds of studies and how you would group them if you were going to try to do a study on a certain disease process. epidemiological models, a framework for collecting or organizing epidemiologic data, the epidemiologic triad, the web of causation. Person, place, time relationships. The sporadic presence of occasional cases of the event apparently unrelated in time. I'm over here at Tuskegee, and I caught syphilis. I don't want it, but that's what they say, that I caught it. So then Ms. Abernathy is down in Montgomery with a new case of syphilis. So that's sporadic, person, place, time. Epidemic, constant long-term presence of an event at about the frequency expected from the past history of the community. This means it was long-standing. Cardiovascular disease was long-standing in Tuskegee. Not just happened yesterday or last week. It's been for years. Epidemic, the presence of the event at a much higher frequency than expected from the past history of the community, usually over a short period of time. Like I said, flu last year. It spread like wildfire across the United States. Every state. There was not a state in the United States that did not have a case of the flu. That was the epidemic. Pandemic, the presence of an event in epidemic portions involving many communities and countries in relative short periods of time. Like I said, if it had spread it from here to Africa, that would have been your pandemic. Cut. What is wrong with this thing? Concepts of epidemiological process. Defining the condition of interest, whatever it is, whatever disease process it is you want to study. Determine its natural history. You got to go way back, find out about it. You got to read about it. Identify strategic points of control. At what point did they get this under control and kind of say, hey, it's not as bad as it used to be? Designing, implementing, and evaluating control strategies. What did they do? What can I do different to eradicate it so it won't be here anymore, so it's not present anymore? This is your epidemiologic triad model. Host, agent, environment. Is it an illness or is it a health problem? It can be, like I said, it can be flu, syphilis, it can be diabetes, heart disease. Your host is going to be the person that it infects. The environment, where did they get it from? The agent, what is it? Epidemiologic triad. The host is your living person, organism, capable of being infected. So, if you can get infected, you can infect her if they don't find treatment for whatever it is. Agent, biologic, chemical, physical, mechanical, or psychosocial mechanism with potential of causing a disease. Coal miners. Some of them have, arsenic poisoning from being in the coal mine for years. They get lung cancer. Black lung is what they call it. That can be your chemical. Environment, internal, external milieu of the host can facilitate, hinder individuals' level of wellness or susceptibility to the disease. Where are they getting it from? Is it the school? Is it the water supply? Is everybody going down to the beach, coming back with it? This is another example, because this will be on your test. She told me to ensure that this, so when you get your PowerPoint, the epidemiologic triad will be on the test. Host, agent, environment. Your agent, TB, is your agent. The host, the person that is poor nutrition, has poor nutrition, concurrent disease. They already have diabetes or lung disease, low immunity. Then the environment. Did they catch it from being in close contact from Sally Jane? Or did they go to the hospital and Sally Jane didn't know she had TB, so she was in a regular hospital room? bad sanitation. The vector, I think she said this will be on your exam also. Vehicle vector, non-living things. Diseases can be spread by clothing, water, or soil. Intermediary vector, living, mosquito, rat, or bat.
One second. Can you go back to that? So you saying?
You need to understand the concept of it. The agent, host, environment is what you need to understand. Not the picture, but the whole host, agent, environment. Y'all got it?
No.
The host, which one?
Not focused on the picture, focused on the environment.
Mm-hmm.
You're saying close contact, bad sanitation, or?
Your environment. Anywhere. It can be anywhere. Is it coming from the water? Is it coming because we all in the same room together? Is it coming from the mall? So your environment can be.
No, that's really a big thing. As an artist, this is probably the most important concept you'll learn this semester.
Right.
Hanging out in crack houses, people are using each other's needles, they're filthy. If you just go to Newtown in Montgomery, new, it's rough. They're
Right.
shooting people up, that's part of the environment. So this is one of the, you'll be testing this in a big way.
Everybody got it. Host, agent, environment.
And you're saying, that it can go from agent to host to environment, or it can go from the environment to agent to host. You're saying like, it's like everything's connected.
It all connects together.
I guess
But
that's
it
specific
starts, whatever it is, something has an agent. Just say, for instance, this shirt I have on. It has an agent. I just put it on. Didn't know somebody else in another clothing store had it on, and they had something. I put it on. I had it. Got it? It's still all connected together.
Yeah, it says it can start anywhere. That's what I'm like. It's not a specific order. It doesn't have to go.
You picking it up from your environment. But it can, because if you pick it up from the environment, like just say for instance your agent was in the environment, because you have to have, the agent has to be present in order to start the whole cycle. That's what you want to get rid of, is the agent. So your agent is there present, right? So it's in the environment together. It's all connected. You got it?
Yeah.
No.
It's like, okay, I'm gonna ask you, so it can start the host. The host has to have the agent.
Yes.
And,
Right? Correct me.
Well, no, the agent is looking for a host to invade.
To invade.
Right, so it's not like a specific cycle.
But it's the overall
It's
cycle.
a human being living in the world. If you go in the grocery store, that's your environment.
Mm-hmm.
And then if there's let's just like that flu, they sneeze, you right beside them, it gets on you. So it's in that environment, and then that agent affects you. Then you go home with the agent in you environment, and it affects everybody else. See how fluid it is?
Yeah.
So basically, the agent is always present.
Right.
So it's starting there, right? Your agent is always present. So, like he said, you go to the grocery store, the agent is present, flu is present in the grocery store. Y'all getting it? Y'all following? Flu is present in the grocery store. I go in the grocery store, touch the counter. I picked it up. Now I have the flu.
Now you the host.
Mm-hmm.
With the high rates of syphilis here in Tuskegee, on Montgomery. Okay, so I'm a host. I have syphilis.
Mhm.
I have sex with somebody else. They get syphilis. So that agent moves through me to the other person
Mhm.
in my environment where we're having sex.
Go ahead.
Does it always start with the environment? Can it start at different places?
Your agent is always present.
So it's always simultaneous.
Agent is always present, so it starts there. Your agent is always present. So like he said, the syphilis case. Syphilis is there. within him being a host, right? You looking confused.
I think, okay, we understand what y'all are saying. I think our question is more of, it's not a cycle that is following. It's not following a cycle. It's just there.
There.
Like the host, you know, the agent's always gonna be there, of course, but the agent has to be on a host or in the environment. So I guess that's what we're trying to.
What you're trying to do, Jalen, is you're trying to break the triangle.
That's what you're trying, because it's a
We
cycle.
want to break the triangle. Do we isolate the patient? Do we kill the agent? Do we change the environment? So it's all very fluid, see? So it's not really A, B, C. They're all going on at the same time. Different agents are introduced to our environments at different times. But you gotta have that host always. Without a living host, a disease can't carry.
You can't carry.
So your disease is your agent, the carrier of the disease, that's your agent. Then the person there is always present and their environment's ever changing. That makes sense?
Yeah.
You do.
It won't be that hard like that on the test, though. It won't. I don't think she will make it like that.
Let me tell you, last semester we had to teach the content over again. People did so bad on the test because they didn't study. Don't underestimate that this is easier than med-surg or OB, because it's not. So I encourage you to go to YouTube and play YouTube about it so that you have an understanding and knowledge of it.
Okay.
You can do it.
Like I said, your vectors are the ways where the disease can be transmitted from. So like I said, the clothing, I had the shirt on, whatever was on the shirt, I got it. Water. We'll take Zika, for instance. You know, Zika is transmitted because of the mosquitoes, right? It lives in the mosquitoes. Your mosquitoes breed from the dirty water. Soil. Anything, something, if a chemical is in the soil, you can catch the disease. Like I said, the mosquito, the rat, or the bat, or yourself. I don't want to do right, y'all. So this is another picture. It looks like a lot. It looks like a lot, but it's not. It's the same concept. Your host, agent, environment. It's an all cycle. It's a big cycle until you break either the host. If I'm the host and I have the flu, I'm going to go to the doctor and get Tamiflu. That breaks the cycle. If it's in the environment, you tell them, hey, cover your cough. Clean up dirty tissue if you got dirty tissue. Hand sanitizer. If the agent, the flu, like I said, get the flu shot. That eradicates, not picking on her, the agent, that eliminates the agent. Like I said, the different kinds of hosts, you have your altered immunity. Or do they have AIDS? What makes their immunity so low? Are they taking steroids, which is making their immune system so low? Altered resistance, risk characteristics, back to heart disease, diabetes. Do you have a family history for it? Is it because you're female? Females are more prone to breast cancer. So do you have that BRCA1 gene to say, hey, you'll get breast cancer or ovarian cancer? Is it because you're 65 years and older? Psychological state, prior disease state, social class, cultural group, occupation. Is it because you work in the coal mine while you got lung cancer? Non-susceptible individuals, the host, natural, artificial, active immunity, passive immunity, natural, artificial. The vehicle, what is your non-living vehicles? Clothing, food, water, that's non-living, so know that. Intermediary vectors are your living, mosquitoes, fleas, rodents, and birds. Your agent, infectious agents, physical agents, chemical agents. whether it's virus, fungal, bacteria, whether it's genetics, is it the noise, temperature, drugs, or toxins. Your environment can be anywhere. So you all need to know that.
And remember, you don't always have a vacuum. Like the rats come in on the ships in Mobile, they climb off the ships in Haiti or wherever, they come in, they infect people. But most of the time, you don't have a vacuum. And that gets people caught up. Vector and vehicle are very different, so remember that.
Tools of understanding the epidemiological triangle. The agent or microbe that causes the disease is the what? Syphilis is the what? I'm sorry. Yeah, is the what? That's what I'm saying is the what? Y'all know it though. Y'all getting it. Y'all getting it. I'm glad. Oh, y'all getting it. Host or organism harboring the disease is the who? Is it you? Is it the rat? It's fine. That's how you learn. That's how you learn it. So your host is, what is the host? Is the who. Environment or those external factors that cause disease transmission. Where is your environment? Where did you get it? Who, what, who, where? What is it that you got? Who did you get it from? And where did you get it from? Got it? What, who, where? Agent, host, environment. Tools to under the same thing with the agent. It causes disease. Anything that causes disease. Like I said, diabetes causes disease. If alcohol is causing you the disease, fungus, viruses, all that good old stuff. Your host, the organism, is usually a human or animal. Human, cow, dog. I ain't never heard of people getting stuff from cows and dogs. Well, unless it's E. coli or something like that. Yeah, rabies. The disease. Oh yeah, fleas.
Fleas in the house,
Yeah.
bugs, all that stuff.
Oh. The disease lodges in the host. The host may or may not know they have the disease. So you can be walking around with it and don't even know you got it. No signs and symptoms, that's what they call you a carrier. We're going to talk about that. Environment, favorable conditions that surrounding external to the host. So the conditions have to be favorable for the disease or whatever it is to stay there long enough. So just say, if for instance, if I'm going to say flu, got the flu and I touched this. But then Shayna, I can't get that name right. I don't know why I want to call you Cheyenne. I'm telling you, I know, I'm going to get it. Shayna comes behind me and takes a Clorox wipe and wipes the desk down. So the environment is no longer, the agent is no longer there because she wiped it out with Clorox wipe. Allows or causes the disease to be transmitted. Examples are heat, dirty water, poor sanitation, crowded living conditions, season of the year, flu is from November to March, secondhand smoke. Let's take dirty water. You got Jimmy John going down to the Caribbean this weekend, and Zika is high there. So him being, okay, I'm from America, it's cold outside. I don't have to wear no mosquito repellent. I can go down there and have me a good time. Not knowing Zika has a high prevalence in the Caribbean. You go down there, he goes down there. Now he gets bit by mosquito. He don't know. He's just having a good time. Music high, you don't feel nothing bite you on your leg. Bam, you got Zika. So the environment was favorable for Zika because it was warm. They got the water, the mosquitoes got the water to breathe to continue to pass the disease. Time. is a factor when working with the epidemiologic triangle. We monitor diseases and the other health-related events over time. So like I said, flu season is from November to March. So we look at cases from, even though flu can occur outside of those dates, but it's more higher prevalence with flu being in November to March. Breaking the connection. The mission of the epidemiologists, can't say the word, is to break one of the part of the epidemiologic triangle. If we break the connections, we can stop the disease. Like I said, put my hands on the desk, alcohol wipes, Clorox wipes, wipe the table down. It's gone. Lysol the room down, it's no longer in the room. So we broke the chain. We got rid of the agent. A lot of times, the host, I ain't gonna say you're gonna kill a human off because you can't do that. You're gonna go to jail. So you want to try to get rid of the agent, or if there's certain environment that is growing in. Web of causation. A map of the interrelations among factors contributing to the development or prevention of a particular health condition. Identifies both direct and indirect causes of the condition. So we took out of the book adolescent tobacco use. So all of these things up in this web cause the end result for the the adolescent to use tobacco. So social media, they showing pictures all on Facebook, on Twitter, of people smoking cigarettes. Or, the vapes. Let's take vapes. All on social media. Then poor reinforcement, the little 13-year-old mama not monitoring what they doing on the cell phone. So, poor reinforcement. Easy access. Hey, my cousin Johnny is 19. He can go and get me a vape. The purchase of the tobacco use, bam, there's the use of it. Same thing with the media images. Public acceptance. Oh, it's fine for little Jimmy John to use the vape, as long as he at home use it. Why? Why is that okay for your 13-year-old to vape at home? So it's just saying all the factors that lead up to the end result, which is the disease process. This is the same thing. It all intertwines together. Complex, interrelated factors to increase or decrease the risk of disease. Example, lung cancer. You have your lung cancer. Did you get it because it was inherited? Did you get it because you worked in the coal mine? Did you get lung cancer because you smoked cigarettes? Same thing as far as the occupation. Did you work in the coal mine? Or you just had a crappy diet and you just so happened to develop lung cancer. So it all intertwines, and that person may have done all and still had that end result. Element of diverse epidemiologic model. Human biology, environment, lifestyle, healthcare system. All these things plays a major role in an epidemiologic model. So, is it because the same thing? Is it because of genetics, the reason the person got breast cancer? Or was it just it was just, hey, cells mutated. The environment. Was it because he worked in the coal mine? We don't know. Lifestyle. Did he live a vigorous lifestyle where he partied all the time and smoked and drank and he got liver cancer? Healthcare system. Well, he knew he had high blood pressure, but he didn't have insurance. So he couldn't go to the doctor to get treatment for high blood pressure. So the healthcare system failed. Human biologic, like I said, the genetics, inheritance, complex physiologic functions, maturation and aging. Was it because he was old? Go ahead.
Can breast cancer be environmental?
Mm-hmm.
But like
Chemicals being breathed in, different chemicals. It may bypass your lungs And all it takes is one cell to mutate. One cell.
What Ms. Cadell told y'all too about the healthcare system, I want to make one point to y'all. I was in the hospital 7 days in December. That was spinal cord stimulator place. I got my bill, $283,000, $40 per unit for when I was in the hospital. Then I have insurance and I have Medicare. But what does a regular person do with that? You know, I was just stunned. My 3 bills together were over $500,000. You know, young man that I've been working with, some helping him with his career, his wife got sick. Their copay was $40,000.
Wow.
That was UAD. So it's not just poor people; it's the working poor like us.
Right.
You know, you can be busted, get 5, 6 double shifts a week, but you still can't afford the insurance for your baby because it's $600, $700.
Wait, how did she have a copay? Did she not go to the emergency department?
Their insurance was such that they had to pay a certain percentage. He worked for his father's business, or a small business.
Small
Very
business.
successful business in Montgomery, but a small business. And just their part was $40,000. They had to come out of the whole family chipped in and paid it. I mean, think about it. If I didn't have Medicare, mine would be $200,000 or $300,000. So, you know, we're real blessed if we have insurance.
Right.
But universal health care, it's not a political thing, it's a common sense thing. We all need to be healthy and live well together. That's not soapbox, I'm sorry.
Thank you. Did that answer your question? About the breast cancer and the...
Yeah, but could it also, like, okay, of course, like, we know that breast cancer can be genetic, but could it also be, like, an environmental plus genetic for that one person?
Right. It can. And they usually say people that live, I want to say with higher altitudes, have that, so like up north, have higher altitudes than we do here in the south. And they do cause cell mutations to cause different kinds of cancer. Environment, physical environment, psychological environment, social environment. Lifestyle, employment, consumption patterns, leisure activity. Do you smoke cigarettes every day, 2 packs a day? Is that why you got the cancer? Environment, factors in the physical, biological, and social environments that contribute to health-related conditions. Environmental factors affected both host and agent. History of disease. Description of the events that precede in development occurred during its course affected its outcomes. So these 4 terms you all do need to know. Pre-exposure stage, preclinical stage, clinical stage, resolution stage. Pre-exposure stage. Factors are present. The disease process itself isn't present. So I'm going to take flu again. You know it's flu season, but there are no new cases of flu. There are no cases of flu. So the pre-exposure stage is there. The time factor is there. But the disease itself is not there. Preclinical stage, exposure has occurred, but no signs and symptoms. So, like I said, I touched this, got the flu. I don't have any symptoms yet. So that's the preclinical stage. Clinical stage is when I started getting the cough, I got the runny nose, I got the fever, I got the aches and pains. Clinical stage is when all of your disease, your signs and symptoms show up. That's your clinical stage. Resolution stage. Okay, I went to the doctor, got Tamiflu. No longer have the flu after I get through with the medicine. There's your resolution. Any questions on that? You need repeatment of that because you need to know it.
Repeat.
You need repeat.
No, never mind.
You sure?
Yeah.
I need you to know it. Y'all got it? You don't have it. You don't. Pre-exposure stage. Factors are present. The disease process itself is not present. So like I told you, from November to March, it's flu season. We know it's flu season. Nobody has the flu yet, but we know it's flu season. So it's coming. Preclinical stage, exposure to has occurred but no signs and symptoms. Bam. Got the flu. I don't have no signs and symptoms, but I got the flu.
So that's like a late, stage.
Yeah, something similar to that. But it's the preclinical stage. Got the flu, no signs and symptoms. Clinical, think about you going to the clinic because you got the cough and the fever and the achy pain. That's when it got your signs and symptoms. Resolution, you went to the doctor, got your medicine, taking your medicine, you heal. Got it. Got it? Okay. Spectrum of infection, host reaction, subclinical and appearing asymptomatic, preclinical, incubation, clinical, mild, typical, severe, or death, postclinical, conveyance, it means it's no longer there. So let's take subclinical, it's the same thing as the pre-exposure. You're basically asymptomatic. Well, no, that's the preclinical, I'm sorry. You're asymptomatic. It's apparently that it's there, but you're asymptomatic. And it's going into the preclinical phase where you finna start to get your signs and symptoms. It's just sitting and it's brewing and it's twisting and it's turning. Getting you ready to say, okay, I'm finna hit hard, and when I hit her, she's gonna be aching, she's gonna be coughing. Your clinical comes in with your signs and symptoms. And then post-clinical, it comes in and say, I took my medicine, I no longer have the flu. Got it? Environmental characteristics, the reservoir, environment where the organism exists and multiplies. So, like I told you about Jimmy John, or whoever went to the Caribbean. Went down to the Caribbean, mind you now he has a wife back at home. He goes down, he gets Zika because he's there in the Caribbean with the warm water. The mosquitoes are multiplying and spreading, and he gets bit. Now he's a reservoir. The mosquito is the reservoir. A reservoir transmits the agent and actually infects the infected, and they're actually infected by the agent. So Jimmy John, the mosquito was the reservoir, and he gave it to Jimmy John. Mosquito to Jimmy John. A case is an individual who actually has the disease. So one case of Zika is just him. Now, if he go home and have sex with his wife, because that's how it's transmitted, by secretions. So he goes home and have sex with his wife, then his wife now has Zika. So that's two cases. So you understand the two, what a case is? You looking confused.
Yeah, very good. So you saying Jim is the reservoir?
No, mosquito is reservoir.
Mosquito's the reservoir.
He is transmitted.
to Jim.
Mhm.
Now Jim is a host.
Mm-hmm.
Now he go home, it's transmitted by secretion. He has sex with his wife. Now his wife is another case.
Another case. So she's
Oh,
case
two
number
cases.
2. Right. Got it?
So now they both carry it.
Right. So they can give it to somebody else.
So when he go home and give it to his wife, is he now a reservoir? Because he gave it to her? And she a new host?
Because he transmitted it to her.
Okay.
Y'all
So
got
the
it?
reservoir is ever been moving.
Mm-hmm.
So it's not just. So how many reservoirs can it be? Unlimited?
Mm-hmm. Because, like you say, the mosquito first had it, right?
Mm.
Mosquito had it first. Then he went, the mosquito bit Jim. Now he has it. He's the reservoir. He's going home to his wife. She's the reservoir. Now, if she decided to step outside of her marriage and do whatever, now whoever she with can give it to somebody else. That's the same way just like AIDS.
Yeah.
Okay?
But they're not the reservoir until they transmit it.
Till they transmit it.
So he's just a host until he go home and
Then transmit it.
transmit it to his wife.
Carrier. Individual who harbors the agent without actually having symptomatic disease at the time. So, Jim may not know that he has Zika. And he's saying, okay, well, I'm going to go home and sleep with my wife. So he was the carrier. He didn't. Now usually signs and symptoms is just like a cold, just like cold symptoms. So he had nothing. He didn't know. So he's carrying it. Okay. Or let's just say the wife. The wife slept with Jim. Now she's carrying it, but she don't know because she don't no cold. She has no cough, no nothing. That's usually how it presents, just like a cold. I know this a lot of stuff is busy, but what I need you to pay attention to is primary, secondary, tertiary prevention.
Okay.
It comes back.
Question.
Yes.
So, screening.
You already have the same slide, but I need, because apparently a lot of them, I'm just listening to what some people told me. They just, I guess, really just didn't understand it from the quiz. So we need to revisit this, okay? Test, what?
Screening is secondary, pertaining to this slide right here, right? It's the second point, above secondary prevention, under early diagnosis and prompt treatment. So, I wish I could pull up the question, but, it said something about screening, but I'm assuming it wanted us to say it was primary, right? So,
I don't know, because I never saw the quiz, so I don't know. I'm not sure. Like I told you, I gotta take it.
HIV screening, so wouldn't that be a secondary prevention if it was like HIV screening?
And screening is always what?
Secondary.
Okay, that's right there.
Primary would be immunization.
that's one.
So was it something else on the quiz, on the test?
It said you was wrong, but, sorry.
I was
It was 19 questions.
We don't start getting into the quiz.
Yeah, we don't, yeah.
This is way too important. That-
Right.
I mean, that test is over, when the quiz test, but this kind of, the book also is outstanding in this chapter, so really review the book well.
Primary prevention is your health promotion. Health education, so you teaching them what they need to do, what not to do. If you need to give them some help, marital counseling and sex education. If you need to teach them about genetics, hey, get tested. Your mom had breast cancer. So, secondary prevention, your early diagnosis and prompt treatment. So, case finding measures in individual and mass. Screening surveys. That's where you go in and do your blood pressure screenings and your height and vital sign assessment. You want to try to cure and prevent disease process, to prevent the spread of communicable diseases, to prevent complications, and is that sequelae? To shorten period of disability. Going on over to tertiary prevention. This is where you're going to do your more advanced treatment. Provision of hospital and community facilities for retaining and education for maximum use of remaining capacities. So you all need to go back and look in your book and review primary, secondary, tertiary. If you feel like you didn't do good on that test or whatever, because it will be on this test. And this kind of breaks it down as far as with your pre-exposure, preclinical, clinical, and resolution stage. So your pre-exposure, clinical, preclinical stage is primary prevention. Secondary prevention is going to be when your symptoms are present. Tertiary prevention is when you return back to health, or you had to go get admitted to the hospital, or you admitted to the hospital, or you died from whatever it is that you had. So this will be on the test. Core functions of public health and levels of prevention. The nurses engage in core public health function at all three levels. So primary, secondary, and tertiary. We collect data for the assessment, assurance, assess, policy development, inform, and educate. So no matter what stage you're in, education is always key. If you at the hospital, well, if you at the beginning just having a health fair, that's your education. If they admit to the hospital, you still want to teach them about things to do once they go home.
You also do not want to tie your thought process around here to a location. Because you could have clinical stages in the hospital, you could also have resolution stage in the hospital. It's not really there about where you're at, it's about what's going on with you, are you getting better or not?
Right. Because you may need another plan of care. What they're doing may not be working, so you got to start all the way up at the top again, start over, and then work your way back down to the bottom. Primary prevention interventions. Action taken prior to the occurrence of health problems and is directed toward avoiding their occurrence. So, exercise to prevent heart disease. Mental aerobics to prevent memory loss. Immunization to prevent disease is your primary preventive interventions. Secondary primary prevention interventions. Early indication, identification, and treatment of existing health problems and takes place after the health problem has occurred. Screening activities to find health problems. Initial diagnosis of diabetes. So that A1C, if it's greater than 6, then you know, hey, they got diabetes. Initial referral and treatment for sexual abuse. You see the signs of the bruises on the arm. Hey, if you don't mind, what happened to your arm? It may be a child. What happened to your arm? And children will tell you the truth. What happened to your arm? Oh, mama pushed me down the stairs. So if you see those signs, inquire about those things. Because you may just save a life unintentionally. Tertiary prevention interventions. Activity aimed at returning the client to the high level of function and preventing further deterioration in health. Monitoring of treatment and compliance with antibiotics. You know, they always tell you they're going to give you a 10-day supply, take them till they're gone. And that's exactly what you need to do because that prevents what they call superbugs. Take all of your antibiotics. Ongoing counseling for depression, immunizations after measles outbreak to prevent further cases. That same thing Kayla talked about. Get your children immunized. That way you will prevent things like this. Levels of prevention. You see it there more than one time. So if you see it more than one time, what do you think that means? You need to know it. Yes, ma'am.
So like, ER, CPR, that would be primary.
Secondary. And just say they were in the ER and you had to admit them, that's your tertiary care.
So like your urgent care would be your primary?
Yeah. I'm sorry, secondary, yeah. If they were just being screened, no, just screening the secretary. If you was just educating them, like at a health fair.
So if they're in the ER, that's secondary?
Correct me if I'm wrong.
It's not about location, y'all are making about location. It's really about what treatment they're getting.
So if you come into the emergency
Now,
department.
it all may be a primary place, but usually primary is gonna be with where? Doctor's office, health fairs, all those places. You know, secondary, I think you've got it, I think you're trying to get it confused, don't necessarily connect it with place. Think about the activity sort of, does that make sense?
So
So
I
in the
see treatment would
activity-
be secondary or tertiary?
Right, so which one?
I think it'd be tertiary.
What you say? What did you say?
ICU treatment.
Okay, I'm trying to help you get your head around it, okay? It's primary, secondary, tertiary, it's about the intervention. So primary is about educating someone, about a health fair, screening. Once you go past teaching, if you got your screening, what's screening? Secondary. And then your tertiary is what?
Rehabilitation. But where does action for the disease happen? That's secondary, right? Like, I get screening is secondary, but let's say I'm going to the I'm in the hospital now.
That's-
In the hospital is secondary.
Treated for the disease, for everything, you're being treated. If you're trying to resolve the problem, what's it gonna be? Tertiary.
Right, you're just trying to like.
Resolution is coming.
Come,
So death, wellness, rehab, all those things are.
fall
gonna be
under
tertiary.
tertiary.
Right, so it sounds like tertiary is after the fact, though.
Mhm.
But secondary should be, since you said it's after teaching, that sounds like secondary should be from when you get screened for it to right before you, I guess, are leaving the hospital to go to
Tell you
rehabilitation.
what we're gonna do.
Wait, can I
Next week,
add an example?
secondary prevention. Listen to what it's saying, don't get all stressed out. Early identification and treatment of